Hello friends, I am Dr. Sachin Kuber from Circumcision-clinic.in website in Pune city, Maharashtra. I am the chief surgeon and today I am going to discuss one topic that is very important that I have written down it, that painful scar after surgical circumcision or painful sex can be avoided by Alisklamp or ZSR circumcision surgery. So this is very important subject that many patients feel that their sex is painful. This is because there are two reasons or there are two conditions which can be very important for this. Number one is the group of patients who have not done circumcision and they are having painful sex, and group number two, that patients who have earlier done circumcision surgery and they are having painful sex. Two conditions are different. First group, those people who have not done circumcision and are married or having painful sex, is because there may be phimosis, there may be paraphimosis or tight foreskin, there may be balanitis xerosis obliterans or BXO, and there may be a diabetic phimosis or the infections which occur very frequently in diabetes, that is balanitis or balanoposthitis. And the second group is a group of patients who are having painful sex after the circumcision. So this is the topic of today's discussion. I tell you one of my patient's experience. There was this 27-year-old man who was recently married since last 6 months. He came to us from Bangalore or Bengaluru, and he complained me about the painful sex after circumcision. So he told me in the history that he had circumcision surgery 2 years back, and since last 2 years he is having severe pain during erection as well as during penetration at the time of sex. I checked him and found out that behind the glans penis where his circumcision scar was there, he was getting pain. I asked him, where did you do circumcision? He said, I did circumcision in Bengaluru, and the surgeon used a scissor and he has put stitches on the glans penis so that there is circumcision done. And after that healing, that stitches fell down and healing occurred, there formed a painful ugly looking scar, and that was very hard. So while having erections, he had pain on right side of the scar behind the glans penis. So this was his reason, because his nerves, very important nerve endings are there in penis for good sex as well as orgasm, and those were trapped inside his scar. So this was ugly looking painful scar and he was having pain because of that scar. So I advised him to undergo a revision circumcision. In that, what we do is we remove the exact line of the scar completely on all sides, at the bottom, at the right side, at the left side, at the upper side. And his skin was so loose, the circumcision which was done by earlier surgeon, which was so loose that the foreskin was coming over the glans penis. Ideally, that foreskin should not come over the glans penis after circumcision. It should always remain behind the glans penis. The photos for that are available on our website, that is circumcision-clinic.in. Now, what I have advised him, we marked with a marker his exact pain producing scar, and we have carefully cut it with the device like ZSR or Alisklamp. And after excision, we removed that painful scar, as well as we again attach those cut wound edges with the help of a special medication glue. And we did not put stitches this time. With the help of device we cut it, and with the glue we attach those all parts of the skin together, and now he is very happy because now this follow-up which I have taken after 6 months after this surgery, and he is absolutely fine. He is not having any pain now like he used to have earlier. Now there was another gentleman who was 34-year-old. He came to me from Chennai, and he told me that 15 days back he had circumcision. 15 days back, that was so early, and that was producing a very bad looking ugly scar, as well as at the bottom part where frenulum is, there is a very important vein, and that was opened up and the stitches fell down, and he had a very embarrassing situation because his underwears and everything was getting wet with the help of because of blood that was coming out. So again, for that patient we did a revision circumcision, and it turned out to be very fine. We made just it stick with the help of some glue, and we did not put any stitches this time. And after 6 months now are over, and the patients are very happy. I tell you, third experience, there was this 48-year-old man came from Mumbai, and he had a circumcision 10 years ago. This long period, 10 years, had stretched his foreskin so much that I did not believe him when he told me that he was circumcised 10 years ago. Ideally, the skin should always remain behind the glans penis after the circumcision, and it should not produce any ugly looking painful scar. But this man had the so much loose foreskin that was kept by a previous surgeon that it came over the glans penis and completely covered the glans penis even after the circumcision. So the person who was looking at him for the first time as a surgeon, I saw him and I did not believe that he had a circumcision. So what we did, his skin was so big or so loose and coming over the glans penis, we thought we will do this revision circumcision with the help of a ZSR device. That was very useful, and we did the circumcision with the help of ZSR device, and that device completely cut the foreskin which was coming ahead, and it was a painless, stitchless and bloodless circumcision. And now 3 months are over for this surgery, and he has not produced any scar. He is very happy with his sex life, and he has reported that he is not having any pain after the sex or during the sex. Another example I give you, that one very big guy from Hyderabad came to me, and he was recently married, and he had a peculiar complaint that his wife was complaining about the pain during sex. What was the reason? His penis was circumcised at the childhood, and because of the so much long period, that skin has been stretched and coming over the glans penis, and it was producing a very hard and ugly looking scar, as well as a very painful scar at the line of the cut where the earlier surgeon has done circumcision in his childhood. Now we saw this patient and we found that the skin is coming completely over the glans penis, and because of that he is having problem, and his wife is complaining about the pain. That's why what we did was we thought to do it with an Alisklamp device. The Alisklamp device, which was very useful, like this. We put the penis inside and stretch the skin over this tube, and we put it for 7 days. I asked him, he went to Hyderabad again, and I asked him to come back after 7 days. He came again by 7 days, and then we removed it, and completely a fresh new circumcision was done for him. That is, a revision circumcision can be done with this Alisklamp. Usually people claim that this Alisklamp or ZSR circumcision can be done only for the fresh patients who are did not have any circumcision surgery in the past. But now what we can do is, if the skin is very loose and it can come over the glans penis, then in such cases, or the patients who had older circumcisions, we can do this Alisklamp or ZSR circumcision. And this proved very helpful to him, because I'm talking about that Hyderabad patient, that his completely skin was removed, and because of that he is very happy now. His foreskin stands behind his glans penis, and his glans penis is completely exposed. There is no ugly scar. All the bad scar tissue was removed with the help of this Alisklamp device, and he is very happy with the result of the circumcision, because what happened, excess skin was removed, the ugly painful scar was removed, and that's why his wife and he are both are happy, because there is no pain involved during a precious sexual time activity. So friends, I want to tell you that with the help of these devices like Alisklamp or ZSR, or recently what we have started doing is for revision circumcision, we are using a special kind of glue, because I believe that I will not make a mistake which was done by earlier surgeon. Earlier surgeon has cut the skin with the help of scissor, he has put stitches and produced an ugly scar. Also, because of the manual circumcision, there is a loss of sensitivity of the glans penis. That mistake I will not do. So that's why what we have started is we are doing the circumcision with the help of ZSR, Alisklamp, or now we are just using glues to stitch that wound together. So we are not putting any physical stitches, we are just applying the glue so that everything is very tightly adherent with the help of that glue, and there is no stitches, no scar. This is the very common algorithm: no stitches, no scar. That's why no painful sex, and this is very helpful to give you a very enjoyable sexual life. So friends, I hope you understood what I wanted to say, and please like and share this video, and please subscribe to our channel, and we will see you in some another informational video. Thank you for patient watching.